This exercise is very useful if you've got a very externally rotated body. So what that means is the PEC pattern in postural restoration. So basically the body reads, femur is always externally rotated, tibia is externally rotated. Often people stand with their feet open all the time, or at least one foot always open, can even walk with that duck sort of walk. The pelvis is rocked forward and often pushed forward this way and possibly sitting here. The rib cage, the ribs are externally rotated, so the person might look like they're always like this, a really flat back, arched back, or the pelvis is pushed forward all the time, the head's forward to try to get a patent airway and also to balance out what's happening in the pelvis. And the arms often externally rotated. The body can't internally rotate, so you go to internally rotate, just nothing happening here, but there's a lot of movement here. You've got to check the knee range, there's like hardly anything, but it can do a lot this way. That's what will be in testing. What that means is that no matter how much you stretch, you never can touch your toes. So the pelvis can't internally rotate. Or when you bend, your back's always in extension, and then it sort of rounds through some other part. But like this never rounds out. So the back is stuck in extension. And another one people may find is that they find it difficult to squat, especially with their feet hip width and the feet straight. They just come to a point, I just can't go any further. So it means the feet can't pronate, which is a form of internal rotation. Tibias can't internally rotate, femurs can't internally rotate, and the pelvis itself is so stuck in external rotation it can't internally rotate either. So this exercise is very good for that. There's a lot of other exercises good for this too. Ones that unwind the PEC pattern. This one can give very fast results. The other thing is that some people, no matter how much they do, they've never been able to sit back on their heels. Other people seem to do it so easy they just can't do it because the body can't access internal rotation. So a test you can do if you can't sit back, see where you go. So you might find very tight through here, might be pinchy somewhere. If you've had a hip replacement or a knee replacement, you won't be able to do this all the way anyway, just because of the prosthesis. So do the before and after test, do the exercise, and then do a test after again. A key skill you need with this exercise is the breathing, because the breathing brings out or brings down bilateral rib flares. So a lot of people, if you look at them with no shirt on, the ribs sort of stick out here, and often more on one side than the other, but both of them are sticking out. That's a rib flare. It means that the apical parts, the top parts of the rib cage, can't inflate properly. Usually this part, especially on the right, can't inflate properly, and they have pain at the back of the right shoulder because of how the ribs are sitting too. So we get this down. It domes the diaphragm when we breathe in. It domes it to be in a better position, and allows better inflation through here, better inflation through the back and the front of the rib cage too. So how we do this, pop your hands on your midriff, on your obliques, on the soft parts. From here I'm on the bone, it feels hard, so I'm in the midriff here, nice and soft. So I'll breathe in through the nose, softly, easily. So what I'm not doing is going like this. This just winds up my scalenes and actually makes the system more extensor based, as if it wants to go more in this position because the body thinks it's under threat. So I breathe in softly, quietly, in through the nose. Then I breathe out through the mouth. And I aim to get all the air out. That sound like you're fogging up a mirror. So making that sound gets the internal obliques to pull the ribs down and in, and you breathe out until you feel it get tight at the sides, that your side abs get engaged. So then I keep this tension, keep that tight. So all the way through here, I keep that tight. Then I breathe in. So you'll find the rib cage will expand differently now because it can't expand through the rib flare. Then I breathe out again. All the air out is the key cue. It'll get really tight here. We keep that tension now. Breathe in again. And it's just a soft inhale again. I'm not doing this. All right. So that's the main cue, the knack of this exercise. It'll rearrange how your rib cage and your pelvis are talking to each other. So how we set this up, you can use a gym bench. This is quite high for this. It probably needs to be something a lot lower. You can use a chair where you can put your other knee underneath it, underneath the seat of the chair too. So 90 degrees with my hips and my body. That's really important. So I'm going to pop my leg up on the top here at 90 degrees. I'm going to push through this arm. So I'm not hanging out like this. So I push through the elbow. Then I lift up and I stay at 90 degrees with my hips. I'm squeezing here. I have to use this adductor too. Pushing through this arm, body level. And then I'm reaching with this arm, reaching this way, just about a 3 out of 10 effort. And I'm breathing now. So I'm breathing in through the nose, out through the mouth. So I keep breathing out until I feel the side abs engage on both of my obliques here. And there's a gentle reach as I do that. Then I keep that tension I have here. I'll breathe in through the nose, easy. Breathe out again. I keep trying to get more and more air out. I keep it tight through here. I breathe in, it'll expand my rib cage differently, and I've got that gentle reach going on here. 3 to 5 breaths. And this is usually something people need to build up to have the strength to even be able to stay in this position. There should be zero pain with this at all. If it's really painful, regress the exercise. Do both sides, 3 to 5 breaths. You'll find a change with that, but do 2 to 3 more sets of it and you'll have it hold into your body a lot more. So it's using the adductors in a position where the pelvis and the rib cage are in an aligned position, so the diaphragm can dome really well and affect the pelvic floor. It'll affect the hip flexors too. And we're using the adductors to suction the femur into the socket of the hip really well. So the adductors do that as part of what they do. There'll be a lot of muscles involved in this to do the exercise, but that's the primary one, is the adductors. Then go do your retest. So you're either bending forward and you're like, wow, that's a big change. The thing is, we didn't stretch anything. We just altered the position. Therefore, the tension, the way the body wants to hold and guard that area, it's opened up. It's allowed a different way of moving. Or if you had trouble with this one, sit back, you'll find that you can probably sit back a lot further and it's a lot easier, and you can probably be more upright too. And if you want to test out the squat, feet hip width, feet straight, can you go down easier? And most people can. And I recommend doing this exercise every second day, even potentially every third day. If it's quite a lot of pressure, the body needs to build up the strength. Doing PEC reversal exercises, do them daily, even twice daily, will help. This exercise will help consolidate those so it stays in the body, in the nervous system way easier.